Hello, Mrs. Adams. How are you today?
I'm fine, Mrs. Martin. How are you?
I'm good, thank you.
You're welcome.
Well, thank you for being with me today and letting me interview you and ask you some questions about your organization. As I start asking questions, I will be taking some notes as you answer. And I just like to make sure we have permission to record this interview.
We absolutely do, and thank you so much for confirming.
Thank you. So please introduce yourself and tell us what is Scars of the Past major focus.
I am Patti Adams, and I started Scars of the Past. Actually, the thought was birthed like way back in probably like 1998, but I did not actually start the support group until around 2015. Then we became a 501(c)(3) in 2017. The main focus of this group is basically to help and assist sexual assault victims and survivors in any way that we can.
Perfect. And can you tell us a little bit about your mission statement?
Absolutely. Thank you for asking. So, Scars of the Past is a Christian-based network group, basically to support sexually abused women and men. And our goal is to provide a holistic approach in allowing individuals to live a life of freedom through the Word of God.
Perfect, thank you. And is there any specific place where viewers can access this information?
Absolutely. It's on our website, which also includes our vision, which is to seek to equip survivors with tools to deal with internal scars and send them off with a life full of hope.
Perfect, thank you.
You're
How do
welcome.
you go about meeting your goals and objectives?
To reach victims and survivors from all over the world, of course, to heal from a holistic approach and live productive lives in society, I go about reaching it just by constantly being available and being in the present moment, and also working with others who work in similar fields with the same objectives, and that is to just make sure that we can help and support victims in any way that we can.
Thank you.
You're
So
welcome.
what is your target population?
The target population is primarily in the Beaumont and their surrounding areas, such as Port Arthur, the Netherlands, even Houston and beyond. That's my target population because that way, whether a victim wants to contact me via telephone or do a video chat, but sometimes they prefer to meet face to face, that is within my reach to be able to drive to support them. Otherwise, then it would have to be limited to a video chat or a phone call.
Great. And can you tell us a little bit about the activities or services you offer?
So some of the activities and service that we offer is an opportunity to be able to support them. In the past, we actually had support groups when we were located in Crestview, Florida, because now we're registered to work in Florida as well as in Texas. We were able to have support group meetings, and that was very beneficial. It gave everyone a platform to be able to tell their story, give us an opportunity to pray with them. And we also spent time doing different type of curriculum and exercises to help them to heal from the things that was going on. And so that's just some of the activities. Unfortunately, because of COVID, we no longer offer any type of support groups. I am currently working on trying to start that back up, either through our local church or working with our community to provide me space, which and to do that free of charge since we're a nonprofit, or to start up a Find and Hope support group through an organization called Sapria. They allow us to do support groups that's structured under them, as well as use their material. And some of those materials that they use is called Reclaim Hope.
Okay. And when you say them, you mean male and female, and they're adults, right? You don't serve children or minors.
We primarily serve adults. From time to time, I will get a referral to help a child, but typically I would have them go through a child advocacy agency or an agency that's really familiar with knowing how to relate to children. So I've ministered and helped some maybe, between say 16 and 18, but we probably wouldn't go any younger than that. I don't think there's any rules in Texas that's permitting me from being able to do that if we choose to.
Okay. And tell me, in your experience, what kind of problems are the biggest concerns for this particular population?
Well, when a new person or an organization comes to town, they want to typically partner with another agency or other services. And it's kind of hard sometimes to get upper management to work with you on doing that and get back with you in a timely manner. A lot of your different communities have a different culture. And those cultures, it just takes time to know how to relate to those people. Some of them feel like you're going to step on their toes. We already offered this, so we don't need anyone else to support victims and things of that nature. Whereas we want to be able to connect with them and collaborate with them so that we can do better going forward. The other problem that arises is just basically having the data to determine the exact need of the social sexual assault victims and survivors so that we can better serve them. And the only way we can do that is by working with our stakeholders to try to find out what that information is. Yes, there's a lot of information that's online, such as through the Department of Public Safety and things of that nature, but they're typically 1 to 2 years behind. Whereas if you reach out to some of the police departments and agencies of that nature, they may have some more up-to-date information.
Do you think you can rate what the biggest problem is, one being the lowest and 10 being the highest, as far as like lack of services or an overwhelming need in the community for sexual assault support? Can you maybe go a little bit into more describing that?
Yeah, I would still kind of say, unfortunately, it's probably about, and 8 being, a big problem. So I'm using the 1 to 10 as, 10 being the hugest problem. So around, I won't say 10, but an 8, again, just to be able to reach out to upper management and have them get back to you in a timely manner can be a problem. Second, learning the culture of the new community takes time. So that's not something that happens overnight. I've been back in Texas now for a year, and I'm still just working on simple things like getting someone to answer a email for me. Third, I need to get more data to determine the exact need of local sexual assault victims and survivors so that I can know how to better serve them. And so an 8 for the first one, an 8 for the second one, and then a 10, because at this point, I just don't really know how I can serve the community and what good does it do to have a nonprofit organization that's willing and able to help, but they don't even have a starting point of who actually needs the services.
Right. And prior to this interview, I know you mentioned to me that victims' compensation was a big issue. Can you tell me a little bit more on that matter?
Yes, a lot of times victims are not even aware of the fact that there is compensation that's offered to them free of charge through the state for things such as therapy. Unfortunately, some of the victims don't have any insurance, and yet when this happens, they need to have therapy, and therapy costs money. It can be $150 per session. So victims' compensation will come in and pay for some things like that. Some of them don't feel safe going back to their homes, especially if it was a situation where it was a rape that was involving a husband, doing it to the wife or a wife doing it to the husband. They don't have a place to stay. And so some of the resources that can be offered through victims compensation is housing and so that they can be safe, and therapy. Unfortunately, there's so many different applications that come through the system that has to be processed. And from what I've heard from our SAR team, there's literally one person anyway in the Beaumont area that's trying to handle this overabundance of these victims compensations that come through, the applications that come through. And so that's a hardship that I would like to see changed in the future, is for them to employ more people to where the applications can get processed sooner and those victims can get that money in hand.
Yeah. Are there any issues or concerns within your organization that you've experienced?
Yeah, I would say three each issues would include, too many larger nonprofit organizations promoting their services, but they're not actually doing anything. And I see this happen over and over again. Unfortunately, you have an organization to get an overabundance of donations. And so they have all the monies, they have all the resources, but they are not doing something as simple as having support group meetings, even though their websites will say, oh, we meet, say, Wednesday from, 7 to 8 p.m. And then you go there and there's nothing. There's no one to greet you. There's no one there. And so that is a disservice to our victims. The second biggest issue is, basically since COVID, it seems that victims are just less involved with taking care of themselves in regards to sexual assault. I think they've been more focused on how am I going to feed my family? How am I going to pay my rent? And so even though they really, really need the services, they're not reaching out to really say, this is what I need. And third, it appears that even with all of our efforts, very few victims will reach out for the help that they need. And I really hope that this will change now that we're kind of in that new normalcy of COVID, that people are back to implementing some self-care. And self-care would include getting the help that you need to move forward in life.
Yeah, I hope that would happen. But internally within your organization, I know you're ran by recruit volunteers to help you run the organization. So can you tell me a little bit about how many volunteers you have, and is it difficult now in this new area to recruit new volunteers?
We don't have any volunteers. I am the person that you look at for the most part. We have our public health intern, which is Miss Cherry, that's here interviewing us today, that's really helping to get the word out. But my board of directors are kind of serving as board of directors and volunteers. Unfortunately, one of our strongest male leaders passed away this past April, so I will be looking for another male minister to basically support any male victims that come through the system. But I'm hoping that through the church that we join, that I'm able to get some more volunteers to help with the efforts of supporting our victims.
Great. Are there any factors indirectly or directly related to the problems? If so, what are they? These might be characteristics related to the community or the clients you serve that are associated with the problems or how you address. I know you already talked about some of the issues with the larger organizations, but have you noticed any issues with transportation, or is your area really rural? Can you tell us some issues that you've seen maybe in that aspect?
I don't think that transportation would be a problem. And I just say that because, I think people have gotten very comfortable and used to just visiting in the Zoom world. In fact, it even seems to be more available and appropriate to meet, between a screen opposed to trying to get to go somewhere. So the services can be offered this way, which is actually a help for those who are maybe suffering with, gas money or, trying to get childcare. We can still service them. One of the biggest problems that I've noticed right now is trying to work with the community leaders to determine where the services are needed. Cherry, thank you so much, because you've done a great job with sending emails and information to try to connect with those community leaders and stakeholders to find out what those needs are. Until we know what the need are, it's very hard to meet that need.
Correct. What are the biggest strengths or opportunities that you've encountered?
Hmm. Well, Scars of the Past Ministry, I would say one of the biggest strength is the ability and the passion to help all who are in need of healing from childhood all the way to adult sexual assault. Myself, I am a survivor, and I was one of those people who was raped at a very early age and had no idea how much it was going to impact my life, even over into adulthood. And so our support will help in every area, whether it's incest, rape, date rape, stranger rape, community leader rape. There are pastors who rape people in their congregation, which is very unfortunate. There's fathers who are raping their daughters and their son. And so one of our greatest strengths is that I've kind of been there in pretty much all of those areas. So I feel like I'm better able to relate to their problems and their issues. A lot of time, people can be empathetic and sympathetic, but they don't have the wherewithal to be able to really relate. I'll give you a quick example before we move on to the next question. I've never been an alcoholic and I've never abused drugs. So to really be able to relate to someone who has been through that, trying to pick and find that next grain of cocaine on their skin, I can relate on the level that I've had some of my family members go through that. But because I have not, it would be hard for me to really dig deep into what they're feeling and the struggles that they have. With Scars of the Past, fortunately, unfortunately, whichever way you want to phrase it, because I've been there, I know a lot of the hurt that goes with that. I know the triggers, I know the nightmares, I know all the different, such as doubt and discouragement and feeling like it's your fault. All of those things that victims go through, I've been there. So I can really relate to what they're talking about when they say, I'm hurting, or I want to use drugs, or I want to go out there and have sex with many partners because they were introduced to it too early in their life. I can really relate to what that feels like. And I feel like I can help them because of that.
Thank you for sharing that.
You're
I
welcome.
know previously you've also shared with me that an asset in the community was the availability of SANE nurses. Can you tell us a little bit about that availability in your area?
So SANE nurses, for you all who don't know, that's sexual assault nurse examiners. I didn't know what it stood for years. And one of the problems that I ran into when I was in Florida is I would say, well, if a person is assaulted and they come to me and I'm telling them, hey, don't go take a shower, don't get rid of your clothes, you need to go straight to the hospital, you need to get DNA testing so that hopefully they can catch the person who did this to you. I couldn't find a SANE nurse that was on staff at that hospital. And so you wouldn't want to have that victim have to go somewhere else when they've already probably took everything in them just to go to that location. One of the really good things I found out here recently through meeting with our SART team, which is the sexual assault response team, is that they have SANE nurses on staff 24/7. Well, let me take it back, not necessarily on staff, but on call. So if a victim was to go to a hospital and they needed to have that rape kit done, the person who needed to get there, that nurse would basically be a phone call away. Typically, they have told me they could arrive at the hospital anywhere between 5 to 20 minutes based on where they're located in the Beaumont or surrounding areas. But that was very hopeful for me to know that we have someone that's on call at any time to help that victim.
Thank you.
You're
And how
welcome.
does your organization decide which problem or issues to address?
Well, we're kind of limited in our resources, but big in finding ways to get the help that's needed. We have money for such things as curriculum materials to purchase and print, but we also have the option to download some of the materials free of charge and distribute accordingly. So regardless to any problems or issues that may arise, I'm going to find a way to find a solution, whether it be to come out of my own pocket, whether it be to, go out and have some fundraising, or even to reach out to our community and say, hey, this is the help that I need to be able to continue to service the victims that's in our area.
Thank you. What are some factors that hold you back from making changes within your organization? Are there difficulties you must navigate within your program to address issues? I know you already mentioned that a little bit about what was, keeping your organization from making connections
Oh,
in the
no.
community, but is there anything else internally that you can speak about?
Mm, Well, I need to just basically say this is that, currently I work with awesome board of directors who they advise me, they encourage me, they offer amazing support. And so they're always open to any changes that I suggest. And as a team, we work together through navigating any issues that arise. And so I am not a shy person. I know that I can't do it all. I know I don't have the ability. And also, it may be something that they can bring to the team, whether or not they've been sexually assaulted, that's going to help me. And so anything that I even think may be an issue, I will take it to them and say, hey, what do you feel about this? And they have always been able to advise me, as well as Cherry Martin, who's on this interview with us today. She was a former board member. And so I feel like when you have a lot of different people with different backgrounds, maybe different careers, things of that nature, we can all come together. And the one thing with this organization is that everyone who works with it is a Christian. So we all believe in Jesus Christ. We all know where that healing is going to come from. And we're able to address each other with unity and love. And so that is such a big thing for me, is that we are all, at the end of the day, we come together on one accord and we make it happen. We make it happen to where we can support the victims in any way that they need.
Community you serve. Where do you get the information about the community?
Um, Pretty much through individual websites. I just go out there and, thank goodness for Google and things of that nature that just a click of a hand away. And in Crestview, Florida, when I worked, not only did I do a lot of research through individual websites, I went out and met personally with the people who I felt like would help. Places such as Garden Martial Arts. I went to go visit with them because I wanted to know what type of services they would offer as far as things such as self-defense courses. And they did. They offer some self-defense courses to our victims. I went out and met with the police department because I wanted to know if I could distribute brochures and things so that if a victim came through their area, they would know that we exist. I met with the mayor there to say, hey, if we decide that we want to do a walk or some other way to support the victims, a vigil, are we able to do that? So working with the community leaders there was a big asset, and I'm hoping to do the exact same thing here, is to reach out to those community leaders to let them know that we exist and that we want to help and that they can advise me on ways that I can help.
Thank you. And I know you already mentioned that you need to gather more data, but what types of data or information do you think would be useful?
Oh, I would definitely think for one, the statistics, how many persons have, recently been raped, who's coming through their agency. Is it one person or is it five? What's the age group? Like you were basically saying earlier, we typically will minister to and support anyone, say from 18 till there's no age gap. I mean, I won't say, it could be till 99, to whatever age that they feel like that they need the help. But the only way that we can do this is to find out what the needs are. And so not only on the victim sides, but also on the offender side, we want to make sure that those offenders are being held accountable for what they've done. So, just working with community leaders allow us to be able to do that.
Thank you.
You're
Does
welcome.
your organization ever engage in any form of evaluation? If so, can you describe that process for us?
Sure, of course. Thank you. So once a year, I typically will give an evaluation to our board, and they fill out the information to let me know how well we're doing as far as serving the community. We've done SWOT analysis, so strength, weaknesses, help me, Cherry, opportunities and threats.
Opportunities and
And most
threats.
recently, Cherry did another one for us to make sure that we are always on board with what we need to do. I do not believe that since COVID that we've had any recent evaluations done. So that's something that I hope to do here in the very near future. Um, due to some death members, family members of some of our board, I've currently put a couple of things on hold just because I want to be sensitive to the fact that they are healing right now. But here real soon, I will be sending out evaluations and things of that nature to find out what we're doing and of course what we can do better.
Okay, you do submit annual reports that are available to the public. Is that correct?
Yes, if for Texas, I don't really know how it works because I'm still trying to get familiar with it. Like I didn't know when I came to Texas, I'd have to fill out what was considered a foreign corporation in order to operate here. But in Crestview, Florida, so on the Florida side, there's a thing called SunBiz. And if you go to SunBiz, you can basically see all of the information on scars of the past, from the articles of corporation to the annual reports we have filed and things of that nature. So all of that is public information that can be obtained through going to SunBiz website. And now in Texas, it's through Texas State of Corporations, I believe it's what it's called, but I don't know 100% on Texas how to gather that information.
Okay. And how is the organization funded?
The organization is funded basically through public donations. Everything that we do is through donations from others. Since we're not a private foundation, we have to rely on donations from the public, which has been really helpful because even with some of the curriculum that we had to purchase in the past, now there are organizations who's bigger than us. So Supriya, I've mentioned them before, that I'm so grateful to because we're able to use their curriculum free of charge, whether it be by downloading it and printing it out later, or by allowing the persons to attend the Find and Hope support groups, and they can go through it together in a digital format along with their workbook.
Okay. And then I'd like to ask a little bit about, I know you mentioned before things that were beyond your scope, you have to refer out. Can you tell us a little bit about that process?
Ask it one more time. I apologize.
Yes, when people come to you and it might be something that's a little beyond your scope, how do you go about handling?
If they come to me, I support them. So again, through prayer, through giving them an opportunity to share their stories and things of that nature. But if it's beyond my scope, then say if you were a person that was coming to me, I'd say, Cherry, I've noticed that it appears that you may be suffering with some things that scars of the past is not able to handle, perhaps post-traumatic stress disorder. If you do not mind, I would love to give you the name and the number of a therapist in our local area that you could go and see that could help you to continue to heal in that specific things. And so by gently persuading them, if they need to go to, say, court, then I'm going to try to hook them up with a legal victim advocate who can go with them, because that can be one of the scariest moments. So I would just continue to give them whatever resources that they need to be able to still get the help. Even if I cannot support them in that area, I'm going to get them the support that they need so that they can still be taken care of.
Perfect, thank you.
Sure.
Is there anything else you think it's important for us to know about your agency?
Hmm. I would say just that our agency has a heart for others, and we want to see victims and survivors healed and supported. We're here for you. Our most pressing issue is getting the word out to our local community that scars of the past exist. I believe we're on a good swing when it comes to that because after attending a TASA, which by the way, I hate acronyms that people don't know about, so that's the Texas Association Against Sexual Assault. They recently had a domestic violence and sexual assault summit and that I was able to attend. So I was able to hand out quite a few of our business cards to them to let them know that we exist and that we're here from them. In fact, one lady was like, "Hey, do you serve the people in Newton County?" And I said, "Well, I don't see why not. We're going to serve whoever we can. Just give me the information and I'll make sure that if I can't serve them, I'm going to get them the service." Also, during that summit, we were encouraged that if we were survivors, that they needed some survivors on these sexual assault response teams because only a survivor would know what another survivor needed. So after meeting with them, I was again able to hand out some business cards, but I was also able to have some conversations about scars of the past. Currently, I'm not aware of any pressing needs or problems or issues that our clients are facing. But if I come up with something, I'll get back with you. And through prayer, I just believe that we have so many things that are helped through just prayer. And then being that willing vessel to go out and say, "Hey, Pastor, I have this need. Can you help me? Mayor, Wes, can you assist me with this?" We learned as young kids, closed mouths don't get fed. And I used to wonder, what does that mean? Well, I think it goes along with if we don't ask for what we need, then we'll never get it. So we have to be able to ask so that we can receive those things that's out there. And I will ask for anything because I'm so passionate about making sure that our victims get the help that they need.
Thank you so much. This has been very informative, and I appreciate you spending the time to answer these questions.
Thank
I
you,
hope you
Miss.
have a nice day.
Oh, I hope you have a nice day too. And you take care. And anytime you want to interview me, I am here. And thank you for all of the work that we've done because a lot of you all who may not know, Cherry has been an extreme asset to us from creating infographics. Go out to our YouTube channel. Look at some of the information that she's done. She's done some great videos. Get the word out because the only way we can help is by letting people know we're available. She's done an awesome job in making sure that people know that scars of the past exist. And so I thank you also, Mrs. Martin. You have a great day.
Bye.